Good morning, my fantastic things. Welcome back to the channel. To the newcomers, welcome to the Cavern of Secrets. I'm Kasara, the host of this strange and slightly random channel because, well, at least for this month, I have not stuck to one single topic. I've just been kind of all over the place. But anyways, I hope everyone enjoyed their week and are ready for the weekend, especially since Hocus Pocus 2 comes out today, which I am so excited for. I'll share my review of it Tuesday, so stay tuned for that. And if you don't want to miss it, click the bell icon so you are the first ones notified when that is up. Since the month of September is ending, and it kind of took an interesting turn, at least to me it did. I started talking about mental illnesses and serial killers, which I said I would not talk about. I don't know where this all went, but whatever. I'm finishing the month off with 2 other disorders that seem to be common among serial killers. However, that doesn't mean that everyone with these disorders become serial killers or criminals. Most actually don't, and a high percentage of these individuals do not become criminals or serial killers. Serial killers are actually pretty rare. Granted, we don't hear about them that often. Not since the 70s and 80s, really. We rarely hear about it. And that's actually because they found by constantly notifying the public about serial killers, there was an increase in copycat murders, which made it difficult for the police to actually find the actual killer. That was part of the reason why they stopped kind of notifying us about it all the time. Today we're discussing borderline personality disorder, or BPD for short, and antisocial personality disorder and some of the disorders that coincide with that. Please do not use this information to self-diagnose. We are all biased, whether we want to admit it or not. And because of we're biased, they prevent an accurate assessment. Either we subconsciously believe we have a disorder so that most of the symptoms seem to fit, or we don't want it and miss some symptoms that actually may fit. So it's better to have a professional diagnose. So if you feel you or someone you know has these symptoms, please speak to your primary care physician, therapist, psychologist, what have you, to find out the next steps or how to go about getting tested to see if you do have one of these disorders. Or someone you know. BPD is a serious mental illness in which an individual cannot manage their emotions effectively. It typically occurs during adolescence or early adulthood. Most individuals with BPD suffer from problems regulating their emotions and thoughts, along with impulsive and at times reckless behaviors, which can lead to unstable relationships. Or they have unstable relationships. Other symptoms include frantic efforts to avoid real or imagined abandonment by friends and family, unstable personal relationships that alternate between idolization and devaluation, so switching between love and hate for an individual. This behavior is also called splitting. Self-harming behaviors, impulsive behaviors that can have dangerous outcomes such as reckless driving, unsafe sex, overuse of substances, or excessive spending. Some individuals have distorted or unstable self-images, which affects moods, values, opinions, goals, and relationships. Sometimes they have periods of intense depression, irritability, anxiety, feelings of boredom or emptiness, or have an inappropriate, intense, or uncontrollable anger, which is often followed by shame and guilt. A show called Good Trouble has a character on it called Isabella, and they kind of fit the disorder. Now, Hollywood never does a really good job depicting mental illnesses because they tend to over-exaggerate the symptoms. But if you're curious to see kind of what it's like, give the show a watch. It does also talk about a lot of societal issues as well, which is part of why I like the show. The characters are great. Just try and give it a watch if you're interested in that type of stuff. Some people with BPD are high functioning in certain settings. Their private lives, however, may be in disaster or utter chaos. There are other disorders that can exist along with BPD, such as depression, anxiety, eating disorders, substance abuse, and other personality disorders. BPD is often missed and misdiagnosed as well. Bipolar disorder is one example of a misdiagnosis, as it too includes mood instability. So sometimes people who actually have bipolar disorder are diagnosed with borderline personality disorder, or somebody with borderline personality disorder are diagnosed with bipolar disorder, and it's mixed up because they both have mood instability. Even though they do have it, there are key differences between the two different conditions. For a person with bipolar disorder, the mood changes exist for weeks or even months, whereas mood changes in BPD are much shorter and even can occur within a day. BPD affects 5.9% of adults, about 14 million Americans at some time in their life. BPD affects 50% more people than Alzheimer's disease, and nearly as many as schizophrenia and bipolar combined, which I thought was a high number. BPD affects 20% of patients admitted to psychiatric hospitals and 10% of people in outpatient mental health treatment facilities. Just some interesting factoids for you. Some potential causes for BPD are genetics, like so many other mental illnesses. So if someone with a close family member was diagnosed with BPD, there's a higher risk for someone developing BPD in the family. Environmental factors are also a potential cause, like other mental illnesses. So if an individual experienced physical or sexual abuse during childhood or neglect and separation from parents, they are at an increased risk of developing BPD. That doesn't mean that they will develop BPD, but they're at a higher risk for it. Another potential cause is brain function, specifically the emotional regulation system. It may be different in people with BPD, which suggests that there may be a neurological basis for some of the symptoms, which I think makes sense. Now, antisocial personality disorder, or APD, I'm sure many of you are familiar with because many people I shouldn't say use, but associate the disorder with terms like psychopath and sociopath. These are not synonymous with APD, but they do fall into the same category. Now, according to the DSM, children often start with oppositional defiant disorder, depending on their age, how long the symptoms have been present for, and what the symptoms are. If untreated and the child transitions to a new life stage, it becomes conduct disorder. And again, it depends on their age, how long the symptoms have been present for, and what the symptoms exactly specifically are. And if untreated and they reach adolescence or adulthood, it becomes APD, depending again on how long the symptoms have been present for and what symptoms exactly they are experiencing. So, antisocial personality disorder should not be used to explain a person who is an introvert, socially anxious, or uncomfortable around other people. People traditionally with those symptoms are or have social anxiety, not APD. APD is a disorder characterized by a strong disregard to feelings, well-being, or interests of other people. It's categorized as a disruptive behavior disorder. People with this disorder typically act impulsively, have a narcissistic manner, seek anything that gives them personal pleasure, regardless of the effect their choices may have on others. Researchers believe APD is caused by a combination of issues in both a person's brain as well as their environment. Again, like most mental illnesses. Oppositional defiant disorder is typically seen in children and teens. Symptoms include having frequent temper tantrums, arguing a lot with adults, refusing to do what an adult asks, always questioning rules and refusing to follow rules, blaming others for their misbehaviors or mistakes, being easily annoyed by others, having an angry attitude, speaking harshly or unkindly to others, seeking revenge, or being vindictive. These symptoms happen more frequently than, say, a child who acts out because they're tired, hungry, or upset about something. Maybe they had a bad day, so they'll call up an attitude. However, young children can be helped by early intervention programs that teach social skills and how to deal with anger. For teens, talk therapy, learning social skills, and getting assistance with schoolwork can help reduce the problematic behaviors, because sometimes teenagers who are having trouble in school will be more aggressive. They'll lash out or they'll be more depressed, which can still portray irritable behaviors because they're frustrated and they feel like they're not getting the help that they need. I've been there when I was a kid. That's how I felt. Conduct disorder is a little more severe than oppositional defiant disorder. Their behaviors are more hostile and violent. In adolescents and teens with the disorder, they can have bouts of aggression, deceit, and coercion to be gratifying. These behaviors include bullying or threatening behaviors, physical aggression, cruelty towards people or animals, fire setting, breaking curfew, truancy from home or school, trespassing, lying, cheating, stealing, vandalism, and emotionally or physically abusive behaviors. In young people with a disorder, they have trouble feeling and expressing empathy or remorse, showing emotions towards others, and performing well in school or community and blaming others for their poor performance. Now, some kids who do bad in school, it's just because of their learning style. I noticed when I was in school, I did really bad. I did terrible in school. Granted, I was really bullied, so that played a part in it, but I'm not a memorizer. I'm a critical thinker, so I didn't do well because of that. I think schools are for memorizers and not for critical thinkers or creatives. And I think if you are a creative or critical thinker, you're more likely to fail, unfortunately. But when I got to college, I aced my classes because critical thinker. I didn't do that bad, which was really shocking for me because I expected myself to fail. I was so nervous to go to college because of it, but yeah. So I think it just depends on your learning style. Some potential causes for the disorder in children is having experienced abuse or parental rejects or neglect, being diagnosed with other disorders, biological parents diagnosed with ADHD, alcohol use disorder, depression, schizophrenia, or bipolar disorder, poor nutrition, living in poverty, maternal mental illness, poor parenting or lack of parental involvement, overly harsh, inconsistent, or ineffective discipline, exposure to violence, whether at home, at school, from peers, maybe from TV, video games, what have you. Peer delinquency, having been subjected to various forms of abuse themselves, or lack of adequate parental or other adult supervision. These aren't necessarily guaranteed to cause conduct disorder, but children who are in these types of environments are at a higher risk for it. Unfortunately, if you look at serial killers with APD, they didn't have the best childhoods, and it's not really surprising that they turned out the way they did. That isn't to say that other kids living in a similar environment will turn out the same, but they may partake in criminal activity. And again, it doesn't mean that they're guaranteed to, it's just that they're at a higher risk. I'm so sorry for how long this video is, but there was a lot to cover. I hope you enjoyed the video nonetheless, and if so, don't forget to hit the like and subscribe button to join the family and to show your support from myself and, of course, the channel. It's greatly appreciated. You guys are amazing. Later tonight, I'll be comparing the American remake Pulse versus the Japanese original since I finally watched it the other day. If you don't want to miss that, click the bell icon to never miss a new video and be the first ones to be notified. I hope you all have a wonderful weekend. Take care until next time, and I hope you all enjoy Hocus Pocus for those that actually are going to watch the next movie. Thank you again. Bye, everyone.